Good afternoon, and thank you for joining us for this afternoon's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. Well, welcome to the media in attendance this afternoon, and we do remind you that we will be taking questions at the end of the briefing this afternoon. And all you need to do, if you're new to Microsoft Teams, is click on the text bubble with the question mark at the top of the screen. That will allow you to submit your questions, and if you could indicate your name as well as your media outlet and who your question is for. Finally, welcome to those who are joining us this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio 980 CFPL, and those who are attending by watching on the CTV London website. Let's begin with our opening remarks, and we'll start with Mayor Ed Holder.
Well, thanks, Dan, and good afternoon, everyone. So Ontario's proof of vaccination program went into effect yesterday. And while it may take some time getting used to, especially in the absence of QR codes, which arrive next month, I'm encouraged by the early returns. See, the vast majority of people in London Middlesex have gotten their shots. And I've heard from many individuals and families saying how much more comfortable they are now in knowing that they're surrounded by other fully vaccinated people, whether they go out to eat or go to a movie, the gym, a number of activities. I've long been in favor of this policy even before it was mandated by the province, because it's absolutely the right decision to keep people and businesses healthy while also driving vaccination rates higher. Now, I'd like to ask all Londoners something. I'd like to ask all Londoners to remain patient and kind with staff at any establishment that now requires proof of vaccination and government ID. Regardless of how you feel personally, this wasn't their decision. They're simply doing their jobs and obeying the law. And I personally appreciate their efforts to keep everyone safe and keep their businesses open. So arguing with staff or harassing them absolutely accomplishes nothing. Again, I'm asking Londoners, be patient, be kind. On a separate topic, I'm imploring students to avoid Broughdale this weekend. It's simply not worth it. All the usual precautions are being put in place, including a significant response from law enforcement and Section 22 orders from the Middlesex-London Health Unit. Western's administration and the USC have also been incredibly proactive. Even with all of those precautions, it's just not safe. I am absolutely and terribly concerned that another student is going to get hurt or worse. And I think Western, in just a few short weeks, has been through enough already. I'll say this, students are an important part of our community. When they're here, we consider them at home. As part of our community, we all have a responsibility to take good care of themselves, of each other, and of our city. During a time when the threat of a fourth wave of COVID-19 is not only real but present, and when we have seen escalating incidents of violence, I would say that out of concern for everyone's safety and well-being, I'm saying to students, avoid Broughdale. That's it for me. Over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. So a couple of quick updates, and then we have some remarkable new data to share. First of all, need to clarify that folks that are looking for support on obtaining their vaccine certificates, or at least the receipts that are currently available, we need to clarify that the phone number to use is the same phone number that you used if you called to book your vaccine. So it's not the health unit number, it's the 226 number that is managed by LHSC, and they're the ones that can help you sort out what how to get a hold of your vaccine passport, vaccine receipt and related information. Some people have had trouble accessing those receipts, and we want to make sure that people can do so. So Dan has just put the number into the chat for this show. It's 226-289-3560. Second, I'm delighted to announce that the Middlesex-London Health Unit has achieved 99% vaccination among our permanent staff. If you include all employees, we're well over 90% and hoping to get right up to 100 across all those groups. But right now, 99% of health unit staff have received their first dose, 96% have received their second dose. Finally, I need to bring to the attention of everyone tuning in that we've had new data showing significantly high rates of COVID in young people, in particular children age 0 to 11 and age 12 to 17. I need to be very clear, these rates are not related to school opening. As we reviewed the data to examine this week, to examine whether school opening had any impact on rates in school-age children, we found that it had not, but that rates actually had been high for about 2 weeks prior to school opening. I'm going to share the chart just now that we've produced about this data. Is that coming through, Dan?
Yes, it is, Dr. Mackie. We're just going
Great.
There we go.
Super. So you can see this is from April 2020 and going through to current day. The two groups that you see in this chart are the yellow is the 12 to 17-year-old group, and red is the 0 to 11-year-old group. So the sort of elementary and junior high plus high school students in two separate groups. And as you'll recall, there was not a lot of activity in 2020 in pediatrics. And then as we hit the fall wave, you saw significant activity in both age groups. That calmed down in February, March of this year. And then with the third wave, we saw significant activity again. The challenging piece of data that we've uncovered here is that since late August, the rates in 0 to 11 and 12 to 17 have been quite high. This is September 12th here, and the 2 weeks prior to that would be, school opening is roughly in this period here. We're not currently seeing any impact from school opening on the data, and that is very encouraging. However, you already, as of late August, saw rates of pediatric cases that were comparable to some of the rates in earlier waves of the pandemic. If you compare, I've pulled out September 12th, the week of September 12th of this year, comparing with the week of September 13th of last year. We're going by Sundays here, so that's why the date is slightly different. The rate is well over 10 times as high. We had one single case in anyone under age 18 in 2020 in that week. This year in that week, we had 28 cases in the 0 to 11 group and 14 cases in the 12 to 17 group. So a total of 42 cases. And you can see the rates here, obviously 0 in the 0 to 11 group, 3 per 100,000 in the 12 to 17 group. Now we're seeing rates of 43 per 100,000 and 42 per 100,000 in those groups respectively. So again, I need to emphasize that there's no evidence that school opening has had anything to do with this. If anything, the reverse, we're not seeing an impact of school opening at this point. We are still relatively early. We may see that at some point. I've grayed out the final data point. There is a data point in our chart if you look at the chart online, but because this is related to only, this is epi data. So it's based on episode date, which is the date at which people become ill. It's not the date of cases being reported. So it's slightly different than the chart you may be familiar with. The episode date is better linked with the actual time of spread of illness, but it is delayed because if someone got COVID today, they wouldn't necessarily get symptoms for 5 to 7 days, and then test results now have some time to turn around as well. So epi date is always delayed, so that week up to September 19th, the data is not reliable here. So don't make too much of the fact that you're seeing a drop at the end here. All this to say, rates in the pediatric population are significantly higher. You can access this data. It is on our health unit dashboard of COVID data. Dan, maybe you can plop the link for our COVID data dashboard there, and you can select other age groups if you want to compare about what's happening in 18 to 24, 25 to 29, etc. Sorry, 25 to 39, etc. I'm going to pause there. We have alerted the Chief Medical Officer of Health of Ontario to what we're seeing locally. We have asked that COVID-19 vaccines be included in the Immunization of School Pupils Act. This is the act that makes vaccines vaccines or a formal process to decline vaccines required for children for a number of childhood illnesses at the moment. The ISPA does not make vaccines mandatory per se. There is an opt-out provision for parents that want to opt out on behalf of their children. But having this in the ISPA does provide another tool, strong encouragement, and the ability for the health unit to track carefully when there is an outbreak who's vaccinated and who's not, which is really helpful as well. In any case, the other thing I should mention about those cases, we have had 102 cases since the end of August in the pediatric population. 92 of those cases were not fully vaccinated. So only 10 of those 102 were among children who are fully vaccinated. Again, and that's primarily in the 12 to 17-year-old group, obviously. Again, vaccination, highly protective and truly making a difference. Currently, if we can extend that vaccination down to the lower age groups, that would make a huge difference as well. So we've also reached out to the federal government to ask that they expedite the approval of the vaccine in the 5 to 11-year-old group. Dan, and pause there. Happy to take any questions.
Thank you very much, Dr. Mackie. And just putting the information about the dashboard and accessing it in the live event Q&A. You can access those tables, our dashboard, through the healthunit.com/novel-coronavirus page. Just click on the new daily local case data graphs tab. And I also put the direct link to the dashboard in there, which I regret to say is quite an ugly link, but it's there nonetheless. All right, let's get to the questions, and there are quite a few in queue. Dr. Mackie, we'll start with the first one. It comes from Jane Sims at the London Free Press. Dr. Mackie, I want to ask about the case that was detected at the Paranide Bar and Grill. First, have there been any more infections linked to the bar? Second, it appears from the health unit's announcement that the bar hadn't kept track of who was there. Will the owners be charged under the bylaw? And is this an example of what's happening at other establishments that led you to issue the Section 22 orders?
Yeah, thanks for the questions, Jane. You're spot on. So we haven't had any secondary infections detected to date, but you're exactly right. The reason we had to issue this public announcement is that the bar was not keeping track of who was there. When we worked through this with the bar management, it looks like there was a miscommunication, a misunderstanding of the direction that person received from the public health inspector. Because we feel the misunderstanding was legitimate, there won't be charges in this particular case, but hopefully this serves as a reminder to all bars and restaurants that you absolutely do need to be tracking anytime someone is consuming in your facility food or drink. You need their contact information, and that's what helps us to do that contact tracing and avoids having the name of your facility in the headlines in a way that you might not want. The question about link to the Section 22 orders, absolutely. This is exactly the sort of thing that we're concerned about with some of those Section 22 orders. You did have close proximity, unmasked people in this facility, and that's why we felt it was so important to make this public announcement.
Let's go to a follow-up question from Jane Sims. Dr. Mackie, one day into vaccine certificate orders coming into effect, have you had any reports of people not complying? Also, what has been the response from business owners to the Section 22 orders that came into effect just an hour ago?
Yeah, thanks for the question, Jane. We had a record for recent times, 860 calls to the health unit hotline yesterday. Mostly, over 700 of those were about COVID, and most of those about vaccine certificates, receipts, etc. Certainly lots of calls for businesses, supporting them with processes, procedures, expectations. We're not seeing a lot of reports at this point about people not complying with the vaccine certificate system. Response on Section 22 orders, again, we do get lots of calls about how to implement that. I noted on social media earlier today that the Chamber of Commerce president announcing that their event went smoothly last night. Fast and easy. Vaccine certificates were not a problem for them in that event, and that was a large event. Of course, it was in a managed facility, so they were able to have 600 people there quite safely, distanced, masked, and of course all vaccinated. So that was great to hear that it is something that they don't have any issues implementing. We haven't had a lot of feedback on the Section 22 orders. It's really around, most relevant to facilities with dance floors, and we're in touch with those facilities already because of our enforcement of other regulations and inspections of their facilities as part of the usual health unit business. So really, it's an education process at this point.
Thank you very much. We do have a couple of other questions from Jane. Dr. Mackie, the health unit has identified another outbreak at a school. Can you tell us the details of what is happening at Sir Thomas More Catholic School?
Yeah, thanks for the question, Jane. I can tell you that at this point, we have a small handful of cases. We have only one case of transmission from what we can tell. The other cases seem to be spillover for what is happening in the community. As I showed in the chart, you've got a baseline rate, unrelated to schools that is relatively high in the pediatric population right now. And you're seeing that spill over and being picked up by the mandatory testing protocols in schools. So of course you're seeing clustering because of random chance, on top of the possibility that you do see some spread in these settings. I want to emphasize that the Delta variant is really a game changer in terms of its impact on children and youth. It is showing up way more heavily in that population than the previous variants that were circulating, including the original variant and the UK variant. So, at this point, we believe that we will see continued spread, continued cases in school-age children, and we're seeing the same pattern and expect to continue to see the same pattern, that most of those cases are actually acquired out of schools. But when we see clustering, we have, we do a careful investigation, but sometimes we have no choice but to declare an outbreak.
Thank you very much. And Jane has one last one, and she's asking on behalf of her colleague Ryan Payette. The Ontario government is allowing the Toronto Maple Leafs to have 9,500 fans, or 50% capacity, at their upcoming game this weekend. When will that happen for the London Knights and Budweiser Gardens, and why wouldn't the same exception apply here?
Yeah, thanks for the question, Jane. I mean, I think that this is probably best directed to the provincial government. We haven't been involved in discussions about that regarding the Knights. We have had some complaints after their first home game around patrons being unmasked even when not drinking or eating, but working with the management there, and we're confident they'll be able to manage that problem.
Let's go to a question now from Sophia Rodriguez from CBC London. Dr. Mackie, we've heard from parents who say they've had to wait 2 to 3 days to get their children tested for COVID-19 at the assessment center. Is the health unit working to alleviate that? Could other assessment centers be opened? And would you know how much testing capacity the assessment center has per day?
Yeah, thanks for the question, Sophia. We've been working closely with London Health Science Centre that operates the Carling Heights Assessment Centre, as well as Ontario Health, which is sort of, as you know, the umbrella health management arm of the provincial Ontario Health, and looking to upstaff the Carling Heights Centre. There is unfortunately a crunch right now in health human resources, and so we may be reaching out to other partners to get involved there. We were able to work with them, this week when the problem of wait times at the assessment center first came up, and they were immediately able to increase the amount of testing available by about 100 tests per day. We're seeing volumes of testing that we haven't seen, any time other than at the peaks of the last couple of waves. There's a lot of testing happening right now in Middlesex and London, and certainly more than expected. Has been a plan to increase testing around school opening, but this has gone beyond what was expected. So working with partners and hope to be able to continue to increase capacity there.
Thank you very much. And a follow-up question that actually I'm not sure if you're able to answer this, Dr. Mackie, but I'll ask it anyway. Dr. Mackie, Sophia asks, according to LHSC, there are now 11 people in the ICU with COVID-19. For weeks, there have been fewer than 5. Are you concerned these numbers may go up? I know an LHSC representative is not here today, but would you know if all of these patients are local?
Yeah, thanks for the question, Sophia. It certainly would be a good idea to ask those questions of an LHSC representative, but I can tell you that, ICU occupancy always goes up in the winter. And so as we see more and more gathering indoors, which is part of, human nature and the pattern we see every year, then it is quite possible that ICU occupancy will go up for COVID as well as other infectious diseases like, we didn't see a lot of influenza last year. We'll see what happens this year on that front. Yeah, I don't have a lot more information about the cases in ICU at this point.
And another question from Sophia. Dr. Mackie, does the Section 22 order, which limits gatherings, apply to events like concerts, such as the Road to Rock the Park concert that is taking place at Delaware Speedway? To what type of events and gatherings does it apply?
Thanks for the question, Sophia. The Section 22 orders on gathering limits really re-emphasize the Reopening Ontario Act. So there are the same exemptions and or provisions related to the Reopening Ontario Act. It really just serves to double the fines so that anyone in violation can be fined under the ROA and the Health Protection Promotion Act that governs public health work. So, as long as that event is being held at a facility that is professionally managed, it's not a private event, then they would have a different set of gathering limits applied to them, primarily around their normal capacity, a percentage of their normal capacity.
Thanks, Dr. Mackie. Let's go to our next question. It's from Jennifer Beeman at the London Free Press. Dr. Mackie, are you impressed with the vaccine uptake among staff at the London area school boards? Is the health unit doing any targeted outreach with the boards to get that rate even higher?
Yeah, thanks for the question, Jennifer. I haven't seen the latest stats from the school boards personally. I was in touch with a friend who's in one of the unions there, and it indicated earlier in the summer that they had great uptake, which is wonderful. I think teachers care about their kids, they care about their colleagues, they care about their families, and of course, all of those reasons mean that the vast majority of them will get vaccinated.
Jane Sims has another question, Dr. Mackie. Do you know how many businesses are you expecting for tonight's webinar with the London Chamber of Commerce?
Yeah, thanks for the question, Dan. Correct me if I'm wrong, but I don't think we have an RSVP out on that, so we don't have an expected number, but we can certainly update you, Jane, as soon as that happens.
I know that Beth Milne, who is in the background today on the call, did have some information. I'm just going to look at that now. We don't, as Dr. Mackie indicated, have an RSVP list, but we know that the Chamber has more than 1,200 members and that they have put the invitation out to their entire membership. So hopefully there's good attendance for that event happening at 5 o'clock this afternoon. Let's go to the next question. Andrew Graham from Global News Radio 980 CFPL. Mayor Holder, question for you. What are some of the preparations being undertaken by local authorities, including police, as we approach the homecoming weekend?
Hi, Andrew. That's an important question. What I can say to it is that we have detailed plans in place. I'd add, though, that these are operational issues that I am not going to make public. What we have is we have a number of partners who are involved in supporting our efforts. That includes, and isn't exhaustive, but as you might imagine, but it includes the city, our city administration, our city bylaw enforcement, Western Police, the USC, our paramedic services, health unit, and there are others. Let me add, what you will see is significant law enforcement present in the Roughdale area. You'll see our paramedic services teams there that'll be on hand to support as needed. And I'd like to add that the police won't hesitate to administer fines, as they did earlier this week, dealing with unsanctioned parties. All of this, as you know, is in line with our Section 22 orders that have been issued by the health unit. So hopeful and optimistic, and I'll reinforce what I said before to students: stay away. It's just the best policy, and is the appropriate conduct.
Let's go to another question from Jane Sims. This one is for Dr. Mackie. Dr. Mackie, I understand you're saying that school opening wasn't the cause of the caseload increase in kids, but are you concerned that the high number of cases might spread in schools going forward?
Yeah, thanks for the question, Jane. I think that it's really difficult to say what's going to happen. Again, last year, we documented a number of cases in schools, and very few of those cases were actually linked to spread in schools. Almost all of them were linked to spread elsewhere. Will that change with the Delta variant? We don't know for sure. Certainly with this number of cases, one thing I'm concerned about is we may see the same thing that we did last year, in that you may have schools where so many teachers are exposed to a child that is ill that you may have, operational impacts. And you saw in our area some school closures last year, not because there was such widespread illness, but because there were so many teachers that have been in contact with, a specific individual or more than one individual that was positive. And so you had to have, operational changes, including in some cases brief closures of schools. That certainly is something that is on the radar, and obviously our partners in the school boards are looking at how to manage that sort of risk. Will we see spread between children or from staff to children or back? We can't say for sure. Obviously, we're looking at it closely, and if and when we're seeing any pattern that deviates from last year, we'll bring that forward.
Thank you very much. And I do want to note that we're at 1:30, but we also got started about 5 minutes late. So we're going to go through the remaining questions that we have in the queue. Related to Jane's question, Dr. Mackie, is a bit of a follow-up from Craig Needles at Blackburn News. Dr. Mackie, with the higher numbers of COVID cases among those 0 to 11 years old, even if we haven't seen the virus spreading in schools, can we be sure that it won't? Should we be considering virtual learning?
I would say that we know that there has been a very small number of cases of spread in schools already this year. Will that increase? No doubt. I mean, you're counting, so the only way to count is up. The question about virtual learning, I think we're way too early to be talking about that. The level of spread we're seeing, again, it's a relatively low risk population. Teachers mainly vaccinated. Is it contributing overall to the spread of COVID in the community? To a certain degree. We also know that children being at home also contributes to spread of COVID in the community. You may have unsupervised play. You may have people that have to pool their childcare that may not have masking involved in their home childcare. That is a risk, and that's what we're seeing in the data. That already in August we were seeing spread among children when school was not in, significant spread, and so. I don't see remote learning, virtual learning being something we should have on the immediate horizon. Do we get there in a few months? It's really hard to say, but I don't believe that it's something we should jump to quickly because of the COVID risk of kids being home, but also, we know that in-person learning is so much more powerful and effective. We know that it's been a huge burden on children and families to be in remote learning situations. That's had a huge mental health impact, which really has to be considered when you're looking at the overall health impact of that sort of change.
Thank you very much, Dr. Mackie. We do have a couple of more questions. Nadine Youssef from the Toronto Star is joining us this afternoon. In regards to the mayor's remarks asking students to avoid going to Broughdale Avenue this weekend, which is Western's homecoming weekend, how is the city poised to respond if students do gather?
Well, Nadine, as I indicated earlier, we do have detailed operational plans in place. We've been meeting for some time with the partners, many that I mentioned earlier as well, who are working proactively to deal with this. You might know that throughout this week, the police have been involved in dealing with a number of unsanctioned events and have laid fines. And I can tell you there will be a proactive, significant law enforcement role to play to deal with this. And I think being at the front end versus trying to jump into a crowd where there's thousands of people and safety becomes a critical issue there, I think would become a challenge. So I think you're going to see, it's probably fair to say, a very proactive response with strong law enforcement as part of it.
Thank you very much, Mayor Holder. And we are going to go to the last question, and it is on the same topic as Nadine's question just a moment ago, and it is for both Dr. Mackie and Mayor Holder, and it comes to us from Andrew Graham at Global News Radio. Mayor Holder, Dr. Mackie, have either of you received any indication to suggest we could see a quiet homecoming weekend, similar to what happened around fake homecoming last year?
Well,
go ahead, Chris.
Cheers, Mr. Mayor. Yeah, I mean, perhaps the mayor has